A 20-year-old man presents with repeated heart palpitation episodes. Further evaluation is indicative of an abnormal conduction pathway in the patient's heart that bypasses the atrioventricular node. Which of the following portions of this patient's ECG is most likely to be affected during normal sinus rhythm? So, is it going to be A, B, C, D, or E? Now, the young person's repeated heart palpitation episodes are telling us that this person has paroxysmal supraventricular tachycardia due to Wolff-Parkinson-White syndrome. Wolff-Parkinson-White syndrome occurs when there is an accessory pathway that is going to bypass the AV node. Okay, so normally the SA node is going to start the electrical activity, and AV node is going to act as a speed limit to slow down that electrical activity before it reaches the ventricles. Now, because we have a accessory pathway, let's say that this dot is the accessory pathway can skip the AV node, so ultimately skipping the speed limit and bring that electrical activity to the ventricles. Okay, so as a result, the PR segment over here is going to be the portion that is most likely to be affected during the normal sinus rhythm. So A is atrial depolarization, V is ventricular depolarization, and B is the time delay between atrial and ventricular depolarization. So if we are skipping the AV node, we're not slowing down, and electrical activity gets to the ventricles uh, beforehand. So as a result, this time lag, is going to be shortened because we're skipping the AV node. Now there's three things on ECG that we need to know for the Wolff-Parkinson-White syndrome, and those are going to be the delta wave that is going to occur with the QRX complex, the shortened PR interval, as we talked about, and there's also going to be a widened QRS complex. And the way I like to think about this is you're going to have a widened QRX complex because the electrical activity that reaches the ventricles are going to be from the accessory pathway. So it's not going to be from the normal bundle of His or the normal electrical system. As a result, the electrical activity is going to be propagated throughout the ventricles much slower because it's not through the normal electrical system. So that's why we have a widened QRX complex with Wolff-Parkinson-White syndrome.